Track 7, Chapter 2, PIP, Eligibility Reform. This track is approximately 6 minutes long. Chapter 2, PIP, Eligibility Reform. Chapter Summary. 68. In this chapter, we look at the potential for retaining the current PIP assessment but making changes to the PIP eligibility criteria, including whether changes should be made to activities, descriptors, points, and the required period condition. Reviewing eligibility criteria. 69. Entitlement to PIP considers the 12 activities relating to daily living and mobility. These can be found in Annex A. The descriptors list a range of actions within each activity which people may be able to perform with or without assistance. Points are assigned to each descriptor to reflect a level of functional ability. The higher the points, the greater the functional impairment. The activities and the descriptors together make up the assessment criteria. 70. Over time, following successful legal challenges, how we define certain elements within the activities and descriptors has changed, and they capture the impacts of some health conditions or disabilities differently than was intended when the activities were designed. We also think that there may be some duplication in the activities in terms of the functional capability that they test. If a functional assessment is retained, we could consider partially or fully reviewing the PIP entitlement criteria to ensure they are working as intended. Our aim would be to ensure that the criteria are fair and that we focus support on people with the highest needs and significant ongoing extra costs. 71. PIP is designed to provide a financial contribution towards the extra cost of a long-term disability or health condition. Claimants are not required to calculate the extra costs associated with their health condition or disability and are able to spend their award how they see fit. Some people receiving PIP may have relatively small one-off costs or ongoing additional costs related to their disability or health condition. Some people may find the current system does not meet their needs in the most efficient or effective way. Extra costs can include aids, appliances, care services, and a range of other needs. Refer to Chapter 3 for a fuller discussion of the range of costs faced. 72. To be entitled to PIP, people have to satisfy a qualifying period of 3 months and meet a prospective test of 9 months. The qualifying period establishes that the functional effects of a health condition or impairment are likely to have been present for a certain time period before entitlement can start, and the prospective test shows the functional impacts are likely to last for a specified period after the award starts. These two conditions are referred to as the required period condition, and they help establish that the health condition or disability is likely to be long-term. 73. We know many people who have short-term illnesses can make a full recovery. We also know that during the early phase of an illness or condition, it is difficult to understand the full impact the condition will have on you. We would therefore like to understand whether the qualifying period correctly captures people with long-term health conditions and disabilities, and the assessment is undertaken when the condition has been present for a long enough period of time to understand the full impact on the individual. We're also interested in views on whether we should retain, remove, or change the length of the prospective test. Chapter 2. Consultation questions. Question 9. Do you think the need for an aid or appliance is a good/bad indicator of extra ongoing costs, and why? Question 10. Do you think the need for prompting is a good/bad indicator of extra ongoing costs, and why? Question 11. Do you think people who accumulate low points across activities have the same level of extra costs as those who score highly in one or more activities? Question 12. Do you think any of the PIP activities measure similar functions and could be merged? Question 13. Do you think any of the PIP activities should be removed or rewritten, and why? Question 14. Should we consider adding any new activities? If so, which activities should be added and why? Question 15. Do you think the current entitlement thresholds levels are set at the right levels to define the need for government financial support, and why? Question 16. What are your views on changing the length of the current 3-month qualifying period for PIP, which is used to establish that the functional effects of a health condition or impairment have been present for a certain time period before entitlement can start? Question 17. What are your views on retaining, removing or changing the length of the current 9-month prospective test, which is used to determine if the functional effects of a health condition or impairment are likely to continue long term? This concludes Track 7.